welcome to our noon educational series from the OHEDI. We're joined today by Sue Wendelgass and Rachel Marcey from the Planned Parenthood of Greater New York to discuss ways to ensure a welcoming and inclusive environment for all LGBTQ plus communities. Some items for us to note before we get started. Please stay muted for the duration of the program. We will have an opportunity for more conversation and Q&A, but while our speakers are speaking, please stay muted. Also, we are recording the session, so please be mindful of that, and it will be available probably by the end of the week via our website or our YouTube channel. And as always, Ishbel, were you going to say something?
Oh yeah, for those joining us from Glens Falls, I will share the video recording with the Committee of Diversity, Equity, and Inclusion there at Glens Falls for them to be able to share with y'all.
Yeah, thank you for that. Okay, and if you do have questions, please feel free to add them in the chat and we'll be able to get to those as well. Okay, so I will turn this over to Sue Wendelgass and Rachel Marcey. Thank you.
Well, thank you very much. Good afternoon, and many thanks for inviting us to speak with you today. I'm Sue Wendelgass. I'm the Director of Specialty Training and Programs for Planned Parenthood of Greater New York, and I use she, they pronouns. And I work under a grant from the New York State Department of Health AIDS Institute to promote LGBT health and well-being across 7 counties in upstate New York. And I'm here today with my colleague Rachel, who's going to introduce herself and get us started.
Thanks, Sue. Hi, everybody. As Sue mentioned, my name is Rachel Marcey. I use she, her pronouns, and I am the LGBT Outreach and Engagement Manager for Planned Parenthood of Greater New York. And I've been working under this LGBT grant with Sue since the start of May of 2019. And as mentioned, today we're going to be talking about ensuring a welcoming and inclusive environment for all LGBTQ plus communities. So I'm just going to get us started here. And by now you should be seeing our PowerPoint. So you will know what to expect. Here are the objectives for today, and we're going to touch briefly on them and then get right into it. So after attending this program today, you will have gained a better understanding of the differences between sexual orientation, gender identity, and gender expression. You'll also understand how bias could impact the perceptions of care and the importance of using inclusive language. And also we'll discuss the difference between intent and impact and how we can respond to instances of biases with cultural humility. Before we go much further, we want to do just a quick review of terms because there are a number of them out there. So LGBTQ+. We always like to make sure that we all start on the same page. We're just going to briefly define each letter here. The first 3 all talk about sexual orientation or who someone is romantically attracted to, and we'll talk a little bit more on that in just a bit. L, lesbian. This is typically referred to as a woman who is attracted to other women. G, gay. In the past, this has been referred to as a man attracted to other men, but really it's just used to describe people whose attractions are to people of the same gender as themselves. B, bisexual, using the prefix bi, which means two. This describes people whose attractions are to those of the same gender and or to those of another gender. The next term here has nothing to do with sexual orientation. Instead, this has to do with a person's sense of themselves or their gender identity. T, transgender, is a term for people who do not feel that they identify as the gender they were assigned at birth. And we're going to talk more about that in just a minute as well. Q can stand for questioning or queer. Queer is a term that in the past has been used to attack the LGBTQ plus community, so some people prefer not to use that term. But some people have since reclaimed the term. It's really important to note that it is up to the person to choose how they identify. We should never be making assumptions or labeling people. Terms can mean different things to different people. It is personal. We're going to talk about that as we go through today. You may have seen this acronym a little bit longer to include LGBTQIA+, the I for intersex, the A can be for asexual or ally. This brings us to the plus because terms are always changing and evolving, so the plus lets us be inclusive without constantly adding letters. And I just want to note on the slide here, we have the rainbow flag, which is the pride flag for the LGBT community. And just below it is the LGBT Progress Pride flag. And this is an updated version of the original pride flag, and it reflects brown, pink, blue, and black stripes to recognize LGBTQ plus people of color, transgender individuals, and people who have died from HIV or AIDS. So just a few terms to know: biological sex, sexual orientation, gender identity, and gender expression. These are terms we hear quite often, so you may be very familiar with them, or you may still have some questions. So we're going to go through a quick review of that right now. And I just want to note that one term is not dependent on another. They are each their own separate piece. Biological sex. This is a sex assigned based on a visual inspection of a baby's genitals at birth. Can also be called assigned sex or gender assigned at birth. Typically, this is a binary choice in the United States in particularly. You choose one, boy or girl. This makes the assumption that there are only two genders and nothing in between. That binary choice is just like when you had a true or false test in school. Again, no room for fill-in, no room for other options. No room for anyone who identifies as something in between or different. On forms, we often only have two options, typically male or female. Again, very limiting choices. Sexual orientation is who a person is romantically attracted to. I touched on this a little bit earlier when we were talking about the LGBTQ+ acronym. This would be the LGB part of that. As with all we're talking about today, this can look different for everyone because, again, it is personal. And just a quick note that transgender people can be any sexual orientation because gender identity and sexual orientation are not the same thing. They're not dependent on each other. So gender identity, this is not visible to others. Gender identity is an internal sense of how a person sees themselves. This is who we feel we are on the inside. Historically, this has been defined in binary terms, male or female. But not everyone fits these strict categories. We now believe gender and even sexual orientation are on a spectrum, changing and evolving with lots of variations, lots of differences in between. Having that spectrum or continuum gives room for everyone to fit. So you can see here on the slide, we have a male figure on one, a female figure on the other side, and just kind of picture them on ends of a spectrum with lots of other ways to describe gender along the line in between them. A person may feel more male some days, more female others, maybe neither male or female, something different, something in between, a little bit of both. And some people may not even use those words to describe themselves. But this spectrum, again, just gives room for everyone to fit. Some refer to themselves as non-binary. Again, just a reminder, binary only lets you choose one. No room for anyone who identifies as something in between or different. And that's, again, why there's so many terms, because people develop them trying to find something that fits for them, because it is personal. We talk a lot about celebrities because we see celebrities in the public eye. Lots of celebrities are identifying as non-binary. Just for example, Sam Smith, Demi Lovato you may be familiar with, and that's just to name a very, very few. This is helping to increase visibility and acceptance for other people who are non-celebrities who identify as non-binary. As you can see here on this map of gender diverse cultures from PBS, cultures around the world have recognized more than two genders, going back thousands of years. Terms and words such as transgender or gay, these are relatively newer words to describe people who have always existed. But starting in the 15th century, the idea of gender as being only male or female was actually imposed upon cultures around the world through Western colonization. Over time, these ideas were forced on cultures that had previously had much broader and inclusive views of gender. Just a few gender identity terms. We know that our biological sex is gender assigned at birth, and gender identity is who we feel we are. So the term cisgender uses the prefix cis, meaning on the same side as. This means that a person's sense of themselves matches the sex that they were assigned at birth. So just for example, a cisgender woman is someone who is assigned female sex at birth and feels that they are female. Thus the term transgender, trans meaning across or on the other side of. Transgender is one of the many terms people use to describe themselves when they don't feel that they were assigned the correct sex at birth for them. We're just using that term today because it's most common. Just as many people feel very sure that they were assigned the right sex at birth for them, transgender people feel equally strongly that they were assigned the wrong sex at birth for them. And I just want to note that just as there are different ways of presenting as cisgender, there are many different ways of presenting as transgender because again, everyone is different. And I want to note here the flag on the slide is the transgender pride flag, which was designed by Monica Helms, who was a transgender woman. And just as a reminder, gender identity, who you feel you are, is not linked to sexual orientation or who you're romantically attracted to. A person can be any sexual orientation regardless of their gender identity. So terms for gender identities, there are so many out there. We like to share this. This is just a list or a little conglomerate of different terms for gender identities from Facebook. And we share this just to show that there are so many. Don't let them overwhelm you because you don't need to know them all. You can always feel free to ask someone what a term may mean to them. Sue and I may both identify as gender fluid, for example, but it may mean something different to me than it does to Sue. We, of course, always want to be careful of our tone, and Sue's going to talk a little bit more about that in just a little bit. But we all know how it sounds when you say to someone, well, what the heck does that mean? Versus when you say to someone, can you tell me what that means to you? People will be looking for disapproval or a negative response, so we want to make sure that we respond appropriately. There's still a lot of fear, especially in the transgender community. Sadly, in 2021, we saw at least 57 transgender or gender nonconforming people killed by violent means. In 2022, we've already seen at least 14 transgender people fatally shot or killed by other violent means. We say at least here because too often these stories go unreported or they're misreported. In previous years, the majority of these people were Black and Latinx transgender women. People have a reason to be cautious, which is why we need to provide space that they can feel safe. Gender expression is how a person shows themselves to the world. It's expressed through a person's name, pronouns, clothing, hairstyle. Gender expression can also change depending on where someone is. So for example, I may look different at the grocery store than I do when I'm at work, than I do when I'm at home. Many people may describe themselves as gender expansive or gender nonconforming if they do not follow gender stereotypes. We often expect people to look or act a certain way depending on their assigned gender, and that is called a stereotype, or what you expect your idea of a man, for example, to look or act like. And that is your idea about gender expression. All societies have gender norms, or what we expect people to look or behave like based on their assigned gender. There have always been people who don't follow these expectations, and this has been happening since the beginning of time. Just for a quick example, historically, women may have dressed and lived their lives as men so that they weren't bound by society's expectations and limitations that were put on women at that time. But people also don't want to pretend to be a different gender. They just want to live as they feel is right and true for them. Again, people whose gender expression does not fit that stereotype for their gender, they're often called gender expansive, or again, you may be more familiar with the term gender nonconforming. And just a few pictures here to show you. We have rapper and record producer A$AP Rocky, also performer Harry Styles, David Bowie, Janelle Monáe. They would be considered gender expansive as they do not always appear in a way that we typically expect males or females, for example, in the United States to look. You may yourself be familiar or knows people who are gender expansive, perhaps someone who maybe identifies as male but chooses to wear makeup. This does not say anything about that person's sexual orientation or who they're romantically attracted to. It only says that they are choosing non-traditional or non-stereotypical ways to express themselves. So to recap what we've talked about so far, biological sex, sex I'm assigned at birth. Sexual orientation, who I'm attracted to. Gender identity, who I am. And gender expression, how I express who I am. One thing I want to note is sometimes people may say, we didn't used to have all of these terms. We never used to talk about all of this. But LGBTQ plus people have existed for years and years and years. But we often didn't talk about them or recognize identifying as LGBTQ plus in a positive way. It wasn't talked about, and that's what left people out, and that's what stigmatized people. This is not an effort to undermine anyone who does not identify as LGBTQ plus, because everyone gets to be themselves still. What we are doing here is making an inclusive environment and giving people the freedom to be themselves, to expand options available, to recognize people for who they are. And each piece helps to make up our human being. So this is our Planned Parenthood human being, which was designed by one of our staff. Some of you may have seen the genderbread person or maybe gender unicorn to explain these terms. The reason that we choose to go with this visual is to stress that we are human beings. We're talking about real people. We're not talking about food, mythical creatures. We're talking about real people with thoughts, feelings, and emotions. So just to sum it up, going from bottom to top, biological sex, sex assigned at birth, and typically, again, a binary choice of either male or female. Sexual orientation, who I'm romantically attracted to. Gender identity, who I know myself to be, my internal sense of self. Again, if it matches the sex I was assigned at birth, it would be considered cisgender. And if it does not match, that could be transgender. And down the far left side here, we have gender expression, or how I show myself to the world, how I dress, the pronouns I use, my hairstyle. And again, it may be different depending on the setting. People who defy gender stereotypes are often referred to, again, as gender expansive or gender nonconforming. So there's some of our terms, and now I'm going to turn it over to Sue to talk about how we use these terms and the impact that we have as healthcare providers.
Thanks, Rachel. So before we get started, sometimes people say, well, how many people are we talking about here? Well, I'm going to give you some estimates because unfortunately, until 2020, the US Census didn't ask about same-sex couples. And when it asked in 2020, it asked about same-sex couples who were living together. So it left a whole bunch of people out. So the best estimate we currently have is there's about 18 million people in this country who identify as LGBTQ+. New York State just released for Pride Month a survey they did, and they estimate that just under 8% of New York State's population identifies as LGBTQ+. And of the folks who identify as part of this community, almost half, 42% of adults, identify as people of color. And I point that out because one of the things we know from research is that LGBTQ people of color are more likely to experience healthcare discrimination compared to either non-LGBTQ people or LGBTQ people who are white. So they have much more hurdles to deal with. The third bullet talks about something that's really a new phenomenon in the US, and that is the younger someone is, the more likely they are to identify as LGBTQ+. A recent survey found the number of people identifying as part of this community has doubled in the past 10 years, and numbers are higher in young people. A national Gallup poll that was released in February of this year found 21% of Generation Z, that's folks who were born between 1997 to 2012, ID'd as LGBTQ+. The New York State Department of Health study released last week found almost 16% of 18 to 24-year-olds in this state identify as part of this community. So I bring those numbers up just to show that we're all seeing these folks for services, whether we know it or not, whether they're telling you or not. Now, let me give a little perspective of why we're excited to do this training today. Our agency offers services to LGBTQ people, including everything from pregnancy testing to sexually transmitted infection testing and treatment to hormone therapy for transgender folks. And on occasion, we have to refer people to outside providers due to them needing services we just don't offer. We always try to refer to LGBT-friendly providers, but locally, that can be a real challenge. We also ask our patients to let us know how their experience was, so we can decide to either keep someone on our referral list or boot them off. So let me give you a couple examples of some of what we've heard lately. One of our patients told us she did not get care for 10 plus years after her provider repeatedly misgendered her and didn't take her health concerns seriously. Health concerns are serious and she has to get care. Another patient told us the doc is great, but the office staff are awful. And when we asked, well, what do you mean by awful? They deliberately misgender you and use the wrong names, and if you correct them, they don't fix it. A third patient told us that she will only see a specific provider within the entire practice, and if asked to schedule with someone else, won't do it as the practice overall is not LGBT friendly, only the one provider. And the last one that really broke my heart was we sent someone to a specialist. And when they went in, it was a transgender male. The staff and the provider openly laughed at him to the point where he left before he got the services he needed. And let me note, these were all reported within the past year and all local to the capital region. So I think there's a pattern here that I want to look at. And what it is, the pattern I see is it's just a lack of respect. It's a lack of treating people with compassion and dignity. None of these people were asking for special treatment. They just wanted to be treated kindly. And instead, once they were identified as LGBTQ+, they were treated terribly. So we're going to watch a brief video now that talks about what LGBTQ people need in the healthcare setting.
To treat me, you have to know who I am. I identify as the Latina lesbian mother.
To treat me, you have to know who I am. I identify as a transgender man.
To treat me, you have to know who I am. I identify as a gay man.
When I was about 15 years old, I remember going into the doctor's office, and I remember telling her when she asked about my sexual activity, if if I use condoms or anything like that, and I said, no, I'm gay. And I just remember her face changed very much, and her warm tone of voice turned very harsh, and it seemed as though she was rushing me out as quickly as possible.
I do think the LGBT community has special needs. I think the LGBT community has a specific special need, which is to be treated the way non-LGBT people have been treated forever, which is to be asked about their sexuality, to be asked about their quality of life, what their home situation is, what their work situation is, what their friend situation is, without the person asking the questions being afraid of what the answers might be.
My partner and I and our children were on a family vacation, and my older daughter became sick. And we get to the hospital, and they asked who was my daughter's parents, and I said, well, she has two moms. And they were like, well, she can't have two moms, only one of you can go in. My daughter was traumatized by that. We were traumatized by that.
My partner was hospitalized recently. When he was being moved from intensive care to a hospital bed, the nurse in charge would not let me accompany him. I asked if I would have been allowed to accompany him if I were part of his family, and she looked the other way.
What needs to happen when a patient is admitted to a hospital is that the care providers think about the fact that the patient might have a different sexual orientation or different gender identity than the care provider.
The people who were dealing with me throughout my pregnancy, primarily my midwife and the nurses associated with them, were not responsive to my identity and didn't actually respect it.
When I was diagnosed with breast cancer, I found that my breast surgeon was unable to call me, even to give me my biopsy results. He did tell me very frankly and overtly that he had problems with my transgender status, and upon meeting and learning my transgender status, he decided that his first impulse was to refer me to psychiatry.
It's not about sensitivity, it's about respect, it's about humanitarian response to a human being in general.
To treat me, you have to know who I am. I identify as a lesbian.
To treat me, you have to know who I am. I identify as a genderqueer, biracial, Latino parent.
And many thanks to the National LGBT Cancer Network for making this video available to us. You know, I think one of the most noteworthy pieces of this video for me is the statement that providers can't assume that everyone they see has the same identity as they do. That's kind of human nature. We assume everybody's like us, has had similar experiences, but it's really not true, and it leaves people out, and in some cases it harms people. So the first point I would suggest is don't assume anything about your patients. Don't look at someone and make the assumption they're LGBT or not LGBT. Let them choose to identify who they are as such, if they feel comfortable doing so. Secondly, if you know someone's LGBTQ+, don't assume things about them like they probably smoke or drink too much or anything else. The LGBTQ community is incredibly diverse, and even though we're going to share some general statistics with you today, best practice is just to ask and listen. Treat each person as an individual, and lastly, also from the video, it's not about sensitivity, it's about respect, the response to a human being. So going back to some of the experiences I talked about, how do we go from respecting someone to treating someone the way folks were treated in some offices? Well, on some level, I think it comes down to bias. What's bias? Well, bias is a preference towards someone or something, and we learn them. We learn them growing up. Biases are learned starting at a very young age. We tend to seek out things that are similar to us, that we're comfortable with. And biases are really how our brains organize things, how we categorize ideas, experiences, even people. It helps us organize the world around us. And we all have biases. Some are positive, like your favorite food or your favorite color, and some not so positive. And we all have both conscious and unconscious biases. Some people are really aware they treat LGBT people badly. They're conscious of this, but others aren't. But it still affects their behavior towards folks. So let's look for a second about the difference between conscious and unconscious bias. Conscious bias is the ones we're aware of and we may act on intentionally. I think the incident that happened in Iowa this weekend, where there were 30 people going to disrupt the Pride Parade in riot gear, is an exact example of conscious bias. Unconscious bias, these are the tricky ones. These are the attitudes we have that we may not even be aware of, but they still impact our behavior. And here's the thing that's important. Even if someone didn't know they acted in a biased manner and didn't intend to hurt someone, if it has a negative impact, it's still not okay. A good example is from the video we just saw. The one doctor would probably say she's unbiased and treats all her patients well. But when she learned the patient was a lesbian, her tone, let's see, I made some notes. Her tone changed, her face changed, her tone became harsh, and she rushed the patient out of the appointment. That provider may not even be aware she has bias against LGBTQ people, but it still shows in her behavior. And that was a situation where someone was offended, but not overtly harmed. Unfortunately for the LGBT community, it's not always like that. So I want to take a couple minutes to look at how LGBTQ folks are impacted in our society. And I want to start with looking at youths. So LGBTQ youth, 50% of transgender people, particularly young ones, are rejected by their family. You know, family rejection can run the gamut. It can range from someone ignoring a kid saying that they feel different, to telling a youth they bring shame on the family, to kicking them out of the house and disowning them. There's an awful lot of bad stuff in between these extremes, but this is one of the major events or markers many LGBT youth deal with. Think of how that affects a kid's mental health to be rejected by family. We certainly know it raises risk for substance use and abuse down the line. Only 1 in 3 LGBTQ kids say their home is affirming of them. Again, how do you think that affects someone's ability to trust people and how they feel valued and how they feel about themselves? The third bullet says bullying and harassment is most common in middle school, and 60% of kids say their teachers don't intervene even when they see it. The ACLU, the American Civil Liberties Union, reported that when school youth were identified as being transgender, just recognized as being transgender, more than 2 in 10 were harassed and bullied to the point they left school. Another 1 in 10 was kicked out of school. So that's over 30% of transgender kids who weren't even able to finish school due to who they were. Think about not only how that affects how they feel about themselves, but how that affects future jobs and earning potential. Puts them at a huge disadvantage right from the start. And lastly, LGBTQ kids make up 40% of unaccompanied homeless youth. When I say unaccompanied, I'm saying these aren't homeless families. These are kids who are out on the street by themselves. We know these kids are subject then to predators, to the sex traffickers and the drug dealers and all that. It's dangerous out there, but some kids have no choice. And these kids start developing trust issues at an early age due to their treatment. So what happens as LGBTQ folks get a little older? Well, unfortunately, it doesn't always get better. For some folks, they lose jobs, they get evicted, they lose custody of children. There are folks who are physically attacked and who have experienced stalking, all for who they are. And for the last few years, and particularly right now, LGBTQ people, especially transgender folks, are seeing lots of negative comments and laws passed about them. Last year in 2021, we saw a total of about 270 laws aimed at LGBT people. This year, by April, we'd already surpassed 340 such proposed laws. And these laws limit folks from playing sports. They affect what bathroom somebody can use. It prevents people from accessing gender-affirming health care, and even restrict people from changing their gender markers on IDs and legal documents. As Rachel mentioned, transgender women of color particularly are being murdered at record rates, and it's affecting us locally. There was a woman murdered in Albany, a transgender woman in Albany in May, and a woman in Vermont in April. It's not something that just happens elsewhere. Books that mention the word gay or portray LGBTQ people in positive light are being banned or pulled from library shelves in schools. So what does this do to folks? Well, the folks I know, we have a navigator here who works with our LGBTQ clients, say all of this is resulting in more people in the community reporting depression, anxiety, and other symptoms. And all of this on top of COVID-19, a pandemic that makes all of us feel off balance and kind of unhappy, and the usual stressors of life. This builds up over time to have a significant negative impact on how a person feels about themselves, and it can affect their physical health as well. You know, it's sometimes subtle, it's sometimes not. You heard it in the video, kind of a little subtle. The nurse who turned away rather than answer the question of if they were a legal family, would he have been allowed to go with his partner? But it's not always so subtle. It's the person shouting, "You're in the wrong restroom," to the non-binary person who maybe doesn't look stereotypically female or male and just wants to pee. It's the person staring on the bus or in a restaurant and pointing and saying, "Is that a boy or is that a girl?" in a voice loud enough for others to hear. These things happen to folks, and it may not be as overt or horrible as physical bullying or assault, but it's a regular reminder to folks that they're different and don't belong. And if someone's a member of several disenfranchised groups, like an LGBTQ person who's also a person of color, or maybe has a disability, it can be even worse as they experience this treatment for multiple identities. It makes people feel terrible. Now, I mentioned a minute ago something about intent versus impact, and we have a very, very short video. It's 1 minute long from Workwell, New York City, that we're going to play for you about that.
Let's talk about intent versus impact. Intent is something you mean to say or do, whereas impact is the result of what you say or do. However, the impact isn't always what you intended. If we are not aware of our impact, then we may not know when a statement or action is hurtful to another person. Even if our intent wasn't to cause harm, someone lets you know that something you said or did is hurtful, what do? First, try not to become defensive or react negatively. Instead, pause, listen, and aim to understand how to be more intentional with your words and actions. Then, focus on the steps needed to move forward. In these ways, we can continue to examine our own actions and their impact. When we know more, we can do more to help others feel understood and respected.
So I think it makes a good point. You know, everybody's different, and you may not realize what someone might find offensive. But studies show that patients do the best when providers try to see them as individuals, not to put them into subgroups like this person's LGBT or this person has a disability. Sometimes people say to us, "Well, I treat everybody the same. I'm fine because I treat everybody the same." That really doesn't work. First, it assumes, again, that everyone has the same experiences and needs, which, as we've been looking at, doesn't apply. And secondly, treating everyone the same isn't the same as meeting someone's needs, which is what we really want to be doing. Treating everyone the same is kind of like you got company coming to your house tonight, and you greet all your guests with strawberry ice cream instead of asking them what they would like to eat. It makes no allowance for things like allergies to strawberries or allergies to milk, or a preference for chocolate instead, or just not liking ice cream. Everybody's an individual, and we have to get to know them and treat them as such. And when we want to talk about healthcare, specifically healthcare, I'm waiting for the slide to move. I'm hoping my screen isn't frozen.
Let's talk about intent versus impact.
Perfect. Oh, we skipped one. Thank you, Rachel. In terms of healthcare, 1 in 5 transgender people have been denied healthcare services just due to their status. They've been essentially told, "I don't see your kind of people here." 45% of transgender adults don't trust their family physician enough to tell them they're transgender. And LGBTQ seniors, who have oftentimes had even worse experiences because how we treated people years ago was even much more overtly worse, are more isolated and are much more likely to not seek services or trust service providers. So, okay, let's talk about long-term impacts. What does this mean long-term to folks? So it means some people have difficulty trusting others, and they are on the alert for non-acceptance and safety issues. When I talk to some of our staff and patients who are in the LGBT community, they talk about assessing every place they walk into for safety. And folks may avoid healthcare, and if they have to get healthcare, may not self-ID. So the question becomes, how do we fix this? Well, In terms of where to start, studies say we form opinions on who we trust within seconds of meeting them. And it's based on what we see and what we hear right away. So first impressions are visual. We enter spaces looking for things that will make us feel comfortable. So we want to start with visuals. LGBTQ people are going to look for things that indicate support for the LGBT community. So look around your space. What do people see? If I didn't have this fake background behind me, you'd see a big rainbow behind me, because that's what we have up on our wall. It gives a message about who is seen, heard, and welcome here. So how would someone who is LGBT view your space? In your office, your waiting rooms, your bathrooms, is there a pride flag, a rainbow sticker, anything? If you're offering telehealth, what does your background look like? An all are welcome here sign is a great background statement. Look at your posters, your magazines. What messages do they give out about who is seen and who is welcome? You know, control what you have, what you can. We can't all get all this stuff, but many of us have to wear lanyards at work. You can stick a button on there or a little rainbow ribbon. People will notice it. It's a great way to let folks know you're accepting. Bathrooms. Bathrooms are huge. Can you have unisex or single stall restrooms that anyone can use? For transgender or non-binary people, bathrooms are places where folks are challenged and threatened, and you can make people feel comfortable and safe with a sign like this, then it welcomes folks. And just to note, this is in the bottom right corner is the bisexual pride flag, another symbol that's commonly recognized in the community. Now let's look at what we say, because words do matter, and you got to back up. If you have all these things, you got to back them up with your actions or it won't matter. Here's what a statistic I want to point out. 45% of LGBTQ youth seriously considered suicide in the past year. They're 4 times more likely to attempt suicide than non-LGBT kids. Yet, kids aged 13 to 24 whose pronouns were respected by all or most people in their lives, it decreased the suicide attempt rate by half. That says how simple this is. How all we need to do is look at our words. Multiple studies, this isn't just one study, it's multiple studies, show that inclusion and acceptance can reverse or offset some of these trends, which is a really hopeful start. So let's talk about some more what we can do in terms of making folks feel welcome when they enter our spaces. And I'm going to start with paperwork, because when we refer someone to an outside agency, one of the first things I'll do is I'll go online and I'll look at their paperwork, because it tells us a lot about a place when you see how they categorize folks. Intake forms, your intake forms are people's first impressions of you. We recommend ask people if they are willing to share a preferred name and a pronoun. Lots of people, not just in the LGBT community, have a formal name, but a different name that they use. Ask somebody either their preferred name or what name would you like us to call you today. That will affect a lot of people and make people feel real comfortable. The second thing is for gender, do not just give people the option to fill in male or female. Give them a blank line to fill in. As Rachel already talked about, there's many, many options to gender. And if you only allow people to check yes, check either male or female, you're going to leave a lot of people out. Think of it this way. As of next week, I believe it's next week, June 24th, New York State is going to allow people to choose an X for their gender marker on their driver's licenses and New York State ID cards. U.S. passports started allowing that in April. If the government can do it, we can do it. And for an LGBTQ person, this makes them feel so much more welcome. It's these little changes that make people feel like they belong.
And
I've already talked.
Can I interject really quickly?
Absolutely.
In the previous slide, when we're recommending, asking patients for what is your preferred name and pronoun, ensuring that you continuously utilize it, right? It can cause further harm if you're asked and you have an assumption, oh my goodness, my provider cares, but it's constantly overlooked, or I'm being referred to a name I don't want to be referred to. That causes further harm. So it's important, if we are asking, that we honor what the patient is telling us as well.
It's not only important that we do that, it's legal. It's legally required of agencies now. There was something passed in 2019 called the New York State GENDA, that was the Gender Expression Non-Discrimination Act, that says that agencies, once someone gives you their preferred name and pronouns, you have to use them, or you can be subject to a human rights violation and a human rights complaint, which means they can fine you and all that. But honestly, you're right. The legal aspects, okay, you could get a fine, but it's the human aspect. This wrecks people. This just, people get their hopes up that this place is going to treat me fine, and then they get treated badly, and it's devastating for people. So nice segue, thank you, into our name slide. Yes, legal name. I'm sure you have to ask for legal name because you probably have to bill insurances, etc. So that's the name on somebody's paperwork, birth certificates, Social Security cards, insurance cards. If someone tells you something's their dead name, know they never, ever, ever want to be called that again. And preferred name really has to be used once you know it. And you're going to make mistakes, and I'll talk about that in a minute, but we got to use preferred names. And pronouns. Pronouns are easy. Think of it this way. I wouldn't look at Rachel, I wouldn't meet her and say, she looks like a Kathy. I'm going to call her Kathy. You ask somebody's name when you meet them. Ask their pronouns too. It's easy. Common, she, he, those are the ones we know. Ella is Spanish. They is very common. They is one of those that's so broad. That's the safe thing to default to if you don't know what to call somebody. Most people are not going to be offended if you say they. Rachel did this, they did this next. Most people are not going to be offended. Where they're going to get offended is when you misgender them and call Rachel a he. Okay, so use they if you don't know, or just use somebody's name. And think about other gendered terms. This is where impact matters. People use the terms hun and sweetie all the time, but for a lot of folks, hun, sweetie, sir, ma'am, they're offensive. So be careful of them. Best practice, avoid them. Also think about other terms. Girlfriend, boyfriend, husband, wife. Instead, think about things like partner and spouse. It's non-gendered. Instead of son or daughter, child. Instead of saying big one we see when meetings start, ladies and gentlemen, we'll get started soon, that leaves people out who are non-binary. We really, really are trying to get people to move to folks or everyone. Good afternoon, everyone. We'll be starting soon. We don't have to do it. And when possible, just drop the gender totally. I get called sir a lot because I have extremely short hair. Well, it's gotten better since I started going gray, but before that, younger women don't have short hair. And if someone wanted to approach me in a store, instead of saying, sir, can I help you? All you have to do is say, can I help you? And it avoids any of that conflict. So there's easy ways to do it. Best practice, ask for preferred name and pronouns annually because it will change. Please don't require folks to give pronouns because sometimes people may not feel safe enough to give them, or maybe in the process of changing them, of reassessing them. And when in doubt, just use somebody's name. That'll get you through. In terms of terms to use, terms to avoid, some of this we've already talked about, but Rachel talked about, we now use the term sex assigned at birth. I'm going to say that we used to say a transgender or transgenders, and now we want to focus on the fact these are people. So it's a transgender person, or it could just be a person. The fourth and fifth line down, we used to talk about things like female to male, male to female, someone who is born male. It is recommended you talk about transgender folks as the gender they know themselves to be. So it would be a transgender man, someone who believes themselves to be male, or a transgender woman, someone who feels that they are female. Terms change all the time. these will be different in another year or two. So the one thing I'm going to suggest is try and keep current, keep educating yourself, and watch people's faces, because if you say something that they don't like, a lot of times you're going to see a twitch. And that leads us into how to fix that. Again, intent doesn't matter. When you hurt someone, we want to try and fix that. So it's 3 really easy steps. Apologize. And don't say, I'm sorry you took me the wrong way, because that's a stinky apology. I'm sorry I called you the wrong name. Don't assume they didn't hear it. People hear it all the time. Every time I'm in a store and someone calls me sir, I hear it. I may not respond to it, but I hear it. Rachel has 2 kind of first names for her name, and every time someone calls her Marcy, you notice, right, Rachel? So people notice this kind of thing. An apology will really help. Don't pretend you didn't do it. Don't pretend they didn't notice it. Don't make it about you and keep bringing it up. Oh, I can't believe I did it. Can you believe I called her the wrong name? No, you're just making a scene. No one wants a scene. Someone may tell you, don't worry about it. It's nothing big. It is important, though, that you apologize, you acknowledge what you did wrong, and then you fix it. Here's the thing. Sometimes what happens is people apologize, and then they keep doing it. They keep calling the person the wrong name or misgendering them. That just pretty much gives the impression that you didn't care enough to really make the change. And someone then is going to feel like you're untrustworthy, and they're not going to want to be talking to you or seeing you. So again, I'm so sorry I called you by the wrong name. Move on, fix it, and do it right from there. Need to know. Some things are fine to ask. Pronouns and preferred name, absolutely okay to ask. For other information, and we're all in the medical field, so this is kind of a standard for all of us. It's the need to know basis. Do you really need it? If you don't need it, don't ask. Most people certainly don't need to know if a transgender person is planning to do surgery, has had surgery, is going to change their name, take hormones, any of that kind of stuff, if they're not their direct medical provider. So it's not okay to be curious or I'm just interested, I'm just curious. These are people, and many of these folks have been really hurt in our society. So we need to show folks we offer kind and respectful service and care to them. We wouldn't leave you without some resources. As I said, ongoing learning is always important. AHI, Adirondack Health Institute's LGBT page is fabulous. It has great resources, it has videos, it has articles, it has links to national and local organizations. The second bullet is the Trevor Project. Some of the statistics I quoted today came from there. They are the hotline for LGBT youth. They are focused on suicide prevention. They have great surveys. They have great services. Check them out. Third bullet is if someone still isn't sure why pronouns matter, short videos of people talking about why they matter. Fourth bullet is the gender. That's the law I mentioned that said you have to call people by their preferred name and pronouns. And if someone is interested in learning about your implicit bias, there's some surveys from Harvard U there. And if you are interested, the last is our Out for Health website that talks about our LGBT services at Planned Parenthood. And we are going to leave you with, I'm going to ask Rachel, we are happy to take questions or comments. And if anyone wants to ask something privately, this is, sorry about that, this is our contact information. Please feel free to either call or email us. We're happy to do that, to respond to folks. And I think we have just about 5 minutes left by my clock to see if there's any questions or anything else folks wanted to talk about today.
Yeah, we have about 5 more minutes left. So folks, if you have some questions or anything like that, please feel free to ask. I would like to take this opportunity to thank you both for coming and speaking. This is very, very important and timely information, and you've been doing this work for, quite some time, but for many people, this is new information. So we really do appreciate you packaging the information in a way that everyone can have access to. Ishbel,
Thank you. We appreciate the opportunity.
Absolutely. Ishbel, do we have any questions that came through?
I don't see any.
Great.
We will also be sharing our slides so that people will have our contact information and all the information that we've shared today.
That's very helpful. Thank you. And we will have this recording available at the end of the week on our YouTube channel and on our website as well. Thank you all for your attention. This has been really, really great and hopefully very informative for everyone. I hope everyone has a really great afternoon.
Thank you.
Thank you.
so
Take
much.
care.
Thank you.